Nearly 17,000 Americans will be diagnosed with esophageal cancer this year, according to the American Cancer Society, and some 15,690 will people die from it. Knowing these warning signs could very well save your life. Esophageal cancer symptom: you have pain or difficulty swallowing. Pain or difficulties with swallowing are the main signs of a tumor in the esophagus, that muscular tube that connects the mouth and stomach, according to Avni Desai, Maryland, a medical oncologist at the Memorial Sloan Kettering Cancer Center outpatient facility in Comic, New York. Desai says people begin to notice pain when swallowing solid foods and eventually feel pain when swallowing liquids. The first hint of dysphagia, or difficulty swallowing, typically happens when people can't swallow a piece of meat or bread. That's a result of the tumor growing, says Ronan Kelly, MD, director of the Gastroesophageal Cancer Therapeutics Program at Johns Hopkins. If the tumor gets to a certain size, it can narrow the opening to the esophageal tube, and can cause that sensation of blockage. If difficulty swallowing persists or gets worse, see a gastroenterologist, who can perform an endoscopy of the esophagus. Esophageal cancer symptom: your reflux is getting worse. Many people get reflux or heartburn occasionally, when stomach acid comes up from the stomach, causing inflammation. But having reflux after most meals isn't normal, and feeling a burning sensation behind the breastbone can be the result of stomach acid leaking into the esophagus. We actually see cancer more commonly in the lower part of the esophagus, right next to the stomach, Dr. Desai says. If you notice the reflux symptoms getting worse or happening more frequently, it might be time to consult a physician. In the meantime, consider taking a break from foods that make heartburn worse. Esophageal cancer symptom: you're coughing after heavy meals. Gastroesophageal reflux disease can cause the lungs to become sensitive. Very often, after people have a meal, stomach acid comes back up and can slightly irritate the airways, Dr. Kelly says. People can tend to have coughing after heavy meals or big meals. Some people can develop asthma as well. The vast majority of people with GERD do not have esophageal cancer, Dr. Kelly notes. However, if you have severe GERD and do not respond to the treatment your doctor prescribed, talk to your primary care physician about whether you should have an endoscopy, a test that looks for any suspicious nodules, which would then be biopsied. Esophageal cancer symptom: you're unintentionally losing weight. If certain foods are hard to swallow, you might stop eating them, which could bring on weight loss. So could switching over to more liquids, or just not eating as much because you don't feel well. Cancer can cause people to lose their appetite, Dr. Desai says. But even if they're eating well and they have an okay appetite, the cancer causes patients to lose weight. If you're losing weight without trying, it could be a sign you need to be evaluated. Esophageal cancer symptom: you're more fatigued than usual. A crazy busy 24/7 lifestyle and nearly any medical condition, from allergies to migraines, can leave you exhausted. But if you're feeling more fatigued than normal and you notice other symptoms of esophageal cancer, it might be time to schedule an appointment with your physician. It's worth noting that esophageal cancer affects more men than women, and people between 45 and 70 are most at risk. If it turns out you do have esophageal cancer, it's operable if found during stages 1, 2, and 3, with or without radiation and chemotherapy first to shrink the tumor.